Phlebotomy EDU 360 brings to you an informative video cast on phlebotomy. Phlebotomy is the procedure of drawing blood from the human body via venipuncture and or dermal puncture. Venipuncture being the act of drawing blood from a patient's vein, and dermal puncture being the act of drawing blood from a patient's skin without vein penetration. A common example of venipuncture is blood drawn from the inside of the arm, near the elbow, providing a large source of blood, while a common example of dermal puncture is blood drawn via the finger and or thumb. This only gives a number of blood drops. Phlebotomy is needed for multiple purposes. The more popular uses for phlebotomy include clinical testing, medical testing, blood transfusions, donations, and research. The professionals who practice phlebotomy are called phlebotomists. Accordingly, phlebotomists are the people who actually draw blood from patients to be used for the aforementioned test. In order to become a phlebotomist, education and phlebotomy training are mandatory. Additionally, depending on the state in which professionals reside, phlebotomy certification and licensure can be required. Phlebotomists commonly work in hospitals, clinics, blood donor centers, inpatient medical facilities, and diagnostic laboratories. Today, phlebotomists are increasingly involved in patient care. As such, phlebotomists must have the ability to perform well under pressure while maintaining professionalism, compassion, and empathy. Because phlebotomists are exposed on a daily basis to bloodborne contaminants and diseases, a high level of expertise and caution must constantly be exercised while performing work-related activities. Common duties of phlebotomists typically include, but are not limited to, properly identifying patients prior to sample collection, accurately explaining procedures to patients, consistently practicing standard and universal precautions, ensuring that the proper amount of blood has been collected via the specified phlebotomy test, instructing patients on post-puncture care, ensuring the correct tubes and proper additives have been used, making sure that blood specimens are properly labeled, delivering blood specimens to the laboratory, and processing blood specimens for the appropriate laboratory departments. Trained phlebotomists are in great demand. According to the U.S. Bureau of Labor Statistics, phlebotomists should see employment growth of about 27% between 2012 and 2022. The growth of the profession is largely attributed to the fact that blood analysis continues to be a vital function in hospitals and labs, boding quite well for phlebotomists and their employment potential. As of August 2014, the BLS reports that phlebotomists earned, on average, $31,410. Currently, the highest paying state for phlebotomy professionals is Alaska. In Alaska, phlebotomists can expect to earn on average $40,200. Conversely, the lowest paying state for phlebotomists is Arkansas, with annual wages averaging $25,180. That wraps up our video cast on an introduction to the field of phlebotomy. We hope we have addressed all questions you had regarding phlebotomy. Should you have additional questions, feel free to leave a comment below. You can also visit our site at phlebotomyedu360.com. Take care.